I was seeing a patient the other day, and she had been in this caregiver role for quite some time, and when she lost both of her parents, she was really struggling with that, and she just needed some nudging in the right direction. You know, she came back in and said, you know, Dr. Yeaman, you've really changed my life. It wasn't one little, bit of medicine that did that. It wasn't a study or a surgery that made that fix, but it was that interaction with the patient.
If we really want to prevent illness, it takes people that care.
One of the big reasons physicians go into medicine is because they enjoy that one-on-one interaction with the patients. And when you give them tools that, even though in the long run may make them better physicians, really interfere with that relationship, that's very frustrating.
The hurdles we face in healthcare are all related to taking away our time from focusing on the patient. Patients come in to see me as the doctor. They don't come in to see me looking at technology.
You know, I went into medicine to take care of people, but yet I've become a documentation specialist, a coding specialist, an insurance coverage specialist. And so there's all these additional layers that I have to work through in order to get to the actual treatment part.
The computer's just a tool. The scalpel is just a tool. What if that scalpel was changing every couple weeks? How good of a surgeon could you be if the primary tool you use to cut, to heal, changed on an irregular, random basis? Well, the same thing's happening with this tool, the electronic health record, and it puts up a barrier that gets between the physician and the patient.
One of the things that I'm optimistic about with devices, it eases some of that strain of working with the EMR to bring back some of that traditional flow that I feel like we've been losing for the last few years.
The question is, how can you deliver that into healthcare so that it starts to improve the overall process? That technology has to be part of the fabric of my office. And I can't believe I'm lucky enough to be here right now at this point in time with the merger of technology and clinical medicine. How did I get so lucky?